We are not that different. I want to understand your perspective and have grace for each other. These are just a couple of the amazing, compassionate quotes from my guests today. Welcome to the show, Dr. Kathleen Edmier and Karen Guerra. They are a psychologist, BCBA, SLP duo from the Marcus Autism Center, which is a highly regarded, amazing clinic facility in the Atlanta area. And today we are getting into SLP BCBA collaboration. They are going to talk about how organically they started a pilot program for this type of collaboration, which we know can be so very difficult. We're also going to get into how do we collaborate around the ideas of some of these hot button topics, verbal imitation and AAC. I can't wait for you to tune into this episode. I'm Rose Griffin, a speech therapist, board-certified behavior analyst, and founder of ABA Speech. It wasn't all that long ago that I felt overwhelmed by providing therapy for my autistic students and any students who were not yet speaking. Fast forward through many doubts, tears, research, and courses, and you will see the framework that I use today and share with over 60,000 readers weekly. One that will help you support your students and feel more confident in the process. I created the ABA Speech podcast to give you simple, step-by-step strategies to help you reach all of your students wherever they are on their communication journeys. If you're a speech therapist, BCBA, RBT student, or parent who's looking to help all students develop a way to communicate with the world, you are in the right place, friend. Let's get started. Welcome to the show. We have a great guest lineup for you today. We have with us Dr. Kathleen Edmier and Karen Guerra. Thank you so much for joining us. I'm excited to have you on the show.
Of course, we're so excited to be here. Thanks for having us.
I was saying before I pressed record that I think that you presented at WIBA conference, which is usually in the summer, and it is Women in Applied Behavior Analysis. I have not been able to attend that conference. Last year I did 12 conferences. Believe me, I've looked to submitting a proposal and going. I think it's usually in Atlanta maybe, and I like Atlanta. I actually love Atlanta. I like that. Think that's a cool vibe there and easy to get to. It is the busiest airport, but I'll tell you what, it is so organized. I appreciate that. When I flew 12 times last year to go to all these different talks I did and conferences, Atlanta is the largest airport, but there's so many people that literally are paid to just look for people who are lost and confused. So shout out Atlanta Airport. But thank you so much for coming on the show today. You guys talked about SLP BCBA collaboration, and it's something that is one of the things that I talk about daily at ABA Speech, being an SLP and BCBA. But I think it's really great to get a new, fresh perspective on it and to hear how people are doing it, especially somewhere like the Marcus Autism Center, which has such a great reputation. I've heard so many cool things about. So today we are going to discuss that SLP BCBA journey and collaboration like we usually do. Can each of you just tell us briefly what your roles are for those of us that are tuning in? Somebody's an SLP, somebody's a BCBA, correct? But let us know what your specific roles are.
Karen, I'll let you go first.
Okay, thanks. Yeah. So hi, everybody. I'm Karen Guerra, and I'm the SLP here. And as part of my work at Marcus, I work in different research and clinical programs. And so that's sort of how I got to be introduced to our skill acquisition program. Yeah. And I guess the other thing I can say is I also work with Spanish-speaking kids. So
cool.
Yeah. And then I am a psychologist and BCBA in our skill acquisition program. So within our skill acquisition program at Marcus, we see children ages 2 to 12 who are pretty significantly impacted in, language and communication realms. And so that's kind of how our collaboration with Karen began as well. Focusing on some of those language and communication skills. But I mostly manage cases within our skill acquisition program and do some research projects as well.
Okay, cool. Can you tell us a little bit about the Marcus Autism Center? I feel like it's this place that I hear all these amazing things about, but I've never been, but I hear it's really amazing. Can you just tell us a little bit about it? Because I'm intrigued.
Yeah. Sorry, Karen and I are probably going to do the like, who's
Yeah. No, if you want to start, and Katie and I can help fill in any of the gaps, because we are ever growing and ever expanding, but we'll do our best to cover. Yeah.
Yeah. Marcus is a wonderful place. I would say we both feel pretty lucky and fortunate and passionate about the work that is done in this building. We have a lot of different programs within a small building, outpatient through Children's Healthcare of Atlanta. But we provide intervention programs. There's a skill acquisition program, which focuses again on like language and communication skills. There's our complex behavior support program, supporting individuals with higher behavior support needs. We have a multidisciplinary feeding program. We also have diagnostics and assessment programs. We have lots of different research in terms of lots of different areas of researchers, clinical implementation research. And I feel like those are the big ones that come to my mind, but tons of other things, Karen, help me out.
No, I mean, this is good. I feel like this is something we all need to know about. I think you covered it. And I think what makes Marcus such a unique place, to be honest, is obviously the amount of expertise that we can learn from Exhibit A, right? This collaboration. But then also, we're not just in the center, we're out in the community, which is really near and dear to my heart. And so we work a lot on partnering with other stakeholders or community representatives, driving both clinical research as well as other programming. So I think that that part is really important. And then we also have Access Lab, which is I'm part of that too, and it's led by 2 implementation science researchers, and that's very important because we'll mention it later on as far as like how our I call it the bromance, but how our relationship and collaboration came about. Yeah.
Romance. See, I like that. That's amazing. See, I have these little things that I say all the time. I'm like, are people sick of me talking about this? And so this is so fun to bring some fresh faces. I like it. Romance. Yes, you're speaking to me. So how do you get started on this collaboration journey? I mean, how did you guys organically, it sounds like you're kind of working in the same program. Is that kind of how this all came about, your relationship?
Well, okay, I'll take the first part, and then Dr. Edmier. I'm going to interchange because you're still Katie to me, but you earn your right. You earn your right to be called doctor as well. So first, I think it was just I want to say by coincidence, but some of us in the center are split across different departments, as Dr. Edmier mentioned. And so I had started to build a little rapport with some of the folks at Skill Acquisition because I was helping run a parent autism support group. And unbeknownst to me, some of those families that were coming to and let me also mention, it was a Spanish speaking support group.
Yeah,
and so it was open to whomever, any caregiver or parent of a child with autism or autistic child in our center and or in the community that had been through our doors. And so anyway, that's how it came about. And then I started to reach out to some of the BCBAs and RBTs about a family or vice versa. And I said, hey, this parent said they just lost their Medicaid. How can we work together? So that was sort of like the entrance. And then the only other thing I would add is the managers at Skill Acquisition made it possible. So Dr. Rachel Yosick and at the time, Dr. Nina Guerin got the conversations rolling with our leadership team.
Wonderful. That's great. And I think collaboration, it's funny. I just became part of this, on this board for this really cool healthcare group called Cicero Therapy. And so they have all these speech therapy clinics, and they're systematically adding in ABA and OT across the United States. And I was talking about having her on the podcast or doing a CEU course for us for speech therapists who might want to add in some of these different services. And she was like, oh my gosh, I was doing trainings about ABA for 6 months before anybody was like, yeah, that sounds like a great idea. We'd like to try it. It and we know we want to help, I say from the research, maximize client outcomes, right? That's stuffy, right? I know, like Karen, you guys both seem super passionate, but it's like you want to help people, right? That's why we both started this, but it can be a long and arduous journey. I think what's cool, because I've worked in places that were multidisciplinary and working with kids with very complex communication needs and behavioral needs. I find that people that are working in some of these outside placements are 100% in. They are like ready to help. You know what I mean? Sometimes when you're in other places, you have to kind of massage the message and work takes a year to like get people to collaborate with you, but I know that you guys were probably like ready to go from the get-go. But what are some things that people should kind of consider in these early stages of collaboration? What are things that people should have an eye on in that process?
Yeah, I can go ahead and get us started on that one. So I think it's, in alignment with kind of what you just said, right? About there's this aspect of like passionate, right? And that leads to our ultimate goal of improving outcomes for the children that we see, right? And so I actually think that focusing on that as like a common goal is super important to come back to, especially when you're collaborating with professionals from different disciplines, right? And so actually being able to come back to like, hey, we're both here because we really want to help this child and this family. And how can we do that together to get to that best goal is actually something that I think we found really, really helpful in our relationship, even when those differences did come up, right? Because as, SLPs and as BCBAs, there's going to be areas where we differ, right? We have different educations, different trainings. We utilize a lot of the different terminology. And so there's going to be differences in how we conceptualize, right? Or the types of interventions or things that we use, or how we might view a behavior, right? Those types of things. But also kind of realizing that we actually have a lot more in common than we realize as well, right? So kind of focusing on what are those areas of alignment, right? What do we have in common? And we're often utilizing, we have a lot of the same goals in terms of our social and communication goals, right? We might say different things, use different words, but often we're kind of talking about the same thing using different language, right? And, ABA therapy that how we've implemented it at that skill acquisition, which is really utilizing like a naturalistic behavioral developmental approach, NDBI. We've really been able to have that alignment as well with SLP. So I think the first thing I would say would be recognizing that while there are differences, we actually have a lot in common. And, how can we be able to come back to that common ground when there might be discrepancies in how we understand or conceptualize or, teach a certain type of social communication skill.
Yeah, I love that. And I just launched a course in September. I read the big NDBI book. I keep saying like, this is a graduate level course book, but I read it this summer and I made a 5-hour course that's ASHA and ACE approved. That's in our membership because there's a lot of, actually Dr. Ariana Boutain, she's actually in Atlanta. She works for a clinic down there in Atlanta, but she just moved there maybe 2 years ago. She came on my podcast a couple of years ago and talked about NDBI. And honestly, that was the first time I had heard about it. And then I read Dr. Schreibman's that initial, article. And then I was like, oh man, there's a book. And so it's interesting because as a speech language pathologist, I feel like it's organically a lot of stuff that we do. And so what I think is cool is to like talk with BCBAs and obviously package it on my end as a CEU because people need those about like, this is like beyond net, right? Like, and what can we take from some of these NDBI protocols if your company isn't going to pay for you to get trained in all the very specific things that they discuss? What can we take from this to make this a really positive, compassionate intervention for our youngest learners? So I think it's cool that you brought up NDBI because we talk about that a lot here. And there's just a lot of people that are not aware that that's a thing, in the field. So thanks for sharing that. But those are some great ideas. And so we know that when we work together, our clients are obviously going to benefit, but I can tell just from the rapport that you two have that you probably have benefited from this collaboration too. So what are some of the benefits that you've seen from SLP BCBA collaboration?
Yeah, I think, for Karen and I, we also, it's a lot of relationship building between us as well. And being able to really have not only that mutual respect for each other's professions, but really as well, like truly wanting to be like invested in like, no, I really want to understand your perspective, like and where you're coming from, right? So I think part of it what also was that we were really invested in having and understanding one another and being able to come from different perspectives with one another. And I think that took it from a different level. Part of that helped us go from that like multidisciplinary to really like interdisciplinary collaboration, right? Because it helped us move past that like, okay, one of the benefits, right, of multidisciplinary collaboration is being able to provide information to one another, right? But I think for Karen and I, that was a benefit of our collaboration, but really taking it to more of this integrated approach and more of an interdisciplinary collaboration allowed us to also like be able to provide one another with more tools and support, right? So things in terms of, I might be able to provide more information and more tools for how to respond to certain behaviors within session, right? And Karen would provide me with, certain information on speech sounds and syllable structures, right? And things that we could do in our ABA sessions. And so really being able to provide more tools to one another to implement within each other's sessions was, I think, something that we found really, really beneficial, as well as supporting a lot of the like generalization and integrity of procedures, right? So for us within our ABA sessions, we have, procedures for responding to behaviors, things like a transition plan. That was something that Karen and I worked on a lot, right? And so Karen being willing and able and invested in like, no, I actually want to help you with this transition plan and let's walk out together, when am I, delivering this reinforcement or, that kind of stuff. It really supported the generalization of those behavioral procedures within both the ABA and SLP sessions, and kind of vice versa, right? Whenever I overlapped and what was able to, as Karen so graciously let me like observe all of her sessions and was seeing all the wonderful strategies and techniques that she was using from an SLP perspective, being able to then carry some of those back into our ABA sessions was just really helpful. And I think for that client, really maximize their potential and their outcomes. But I'll let Karen add a little bit more to that.
Yeah, I mean, we can probably spend hours on this part. I think just simple things like, thinking of having grace for each other, understanding that it's not a competition, right? I mean, I think the field theoretically and it's done that to us from a long, long time ago. And so it's important to speak to even your podcast. Like, why are you doing this? This is bringing people together to say, hey, we're not that different, but there are differences and that's okay. And how can we build together sort of this synergistic approach to treating a child on the spectrum or an autistic child, however folks refer, and move forward. And then on top of that, how can together collaboratively we can better serve these families?
I love that. And you bring up that point about observing. I talk about this article where there's a visual. I can't remember all the authors, but in some of our CEUs where we talk about, are you a salad? Are you a stew? Or like you said, interdisciplinary, are you a cake, right? Because salad, it's like, okay, I'm a speech therapist. I do speech. I'm a BCBA. I do the behavior stuff, right? And then the stew is like more integrated. And I love this idea of, because I've worked in similar places where we're all kind of working together, this idea of role release, role extension. And I always talk about Dr. Cindy Gavarter. I'm not sure if you know who she is, but I'm a big fan of hers. But she is a BCBA, BCBAD, and she has this wonderful like lab, and she does a lot of research in AAC. And I'm like, see, this is like where this comes about, because as speech therapists, if I worked in maybe my hometown district here, maybe I don't know much about AAC because honestly, maybe I haven't seen a kid who uses it. But here's a BCBA who I could really learn from, who presents at the ASHA conference, who's done a ton of research in this area. And I think sometimes that's hard for people. I also, in my background, have worked in non-public programs where It's almost like I'm used to people coming in and seeing me do therapy. And not that I had somebody on and he said like therapy is kind of performative, right? We all kind of like before we press record, right? We probably had a little bit of a different disposition. And then we're like, oh, hey, but it is a little performative, but I'm used to it. And I'm sure you get that at the Marcus Autism Center, maybe people doing tours and coming through. And I think people that don't work in settings like that might be like, I don't want a BCBA to watch me do therapy. Like these are a lot of the things that you see online. Obviously, at the Marcus Autism Center and some of these really highly regarded places, it's just this is why you're here, and people want to work here because it is collaborative. So I think for some people, even that thing that seems so small for you to say is like, I watched some of her sessions. I know some speech therapists would just be like, what happened? You did what? Because I don't know what they think is going to happen there. But I like the idea that you say, yeah, we're going to give each other more tools, to help our clients. So, and we are not that different. I like that. It's kind of a quote for the podcast is we are not that different. And I think that's what there's such a divide, such an us versus them, the world that I live on, in social media, that in the real world, collaboration happens. And I'm so glad to have you guys on to see that. So something I want to get to though is a couple hot topics that people will constantly send me messages about. And this is another area where we could go deep, but we won't go too deep, but is the ideas of collaborating around like verbal imitation and AAC. So can you tell us if that, in your skill acquisition program, what does it look like to collaborate around verbal imitation, or BCBAs may call those echoics and things like that?
Yeah. So we, I think part of it is, again, realizing that like we're talking about the same thing, right? Like we might be using different terminology, right? I would say echoic as a BCBA. Karen might say sound imitation. Right, Karen? Correct me if I'm wrong.
Yeah.
Okay. And so, but we're really talking about like the same social communication skill, right? And so realizing that like our goal is to increase that, verbal imitation, right? And really to with AAC, right? Like for that child to be able to request and express what their wants and needs are, right? I might say man, and Karen might say something more along like multimodal communication. Yeah.
Request. Yeah. Yeah. Introverbal, spin the plan. Come on.
Right.
So I think realizing a lot of the times, again, our goals are the same. And we might approach it the same in some ways, right? So a increasing vocals through play protocol, that's something that we talked about like in our REBA presentation that Karen at the way beginning of the collaboration had really helped the ABA team work on those echoic skills within more naturalistic like play context, right? Whereas opposed to sometimes from a BCBA perspective, I might take that in more of a like structured teaching type of format, right?
Mm-hmm.
And so I think for us, it was being able to recognize and realize that we have a lot of alignment in terms of our naturalistic implementation when we're teaching these verbal imitation and AAC skills and creating those opportunities. And so being able to come back to that alignment is really important. But also there might be different areas, again, where we diverge, right? So for the client that we worked with together, we, from the ABA perspective, we're working on a structured backwards teaching protocol to teach verb noun requesting. And so that looked very different. But I think what Karen and I came to is like, it's an additional approach, right? Like we're doing multiple things, but it's all towards the same goal. And being able to build on all of that together is only going to increase the likely that that child's outcome is going to be positive and successful. And so I think for Karen and I, it's like, okay, we're doing this, structured teaching protocol for backwards chaining in the ABA, right? While also including some opportunities naturalistically. Karen was doing a lot of the, NDVI stuff during, her SLP sessions. And so all of that kind of coming together to then just ultimately this child being able to communicate with their AAC device or, being able to have some of that verbal imitation skills. So kind of taking up all the things in the package approach, I think is what we found most helpful.
I think one thing I would add though is, to speak to like the difference in the past is the same. Like we're like BCBA, like doing light tech stuff or low tech, and I thought it was such a huge win. I work with kids with AC devices. However, I would be the last person to say I'm an expert evaluator. That I leave that to somebody else, right?
Yeah.
SLPs and BCBAs, we can wear so many hats. But I
Mhm.
think the one key thing to remember too is when you start seeing those outcomes in your patient and your child, and then the family's like joy of seeing his progress, his or her progress or their progress, it's also kind of reinforcing us to say, hey, guess what? This recipe, whatever it is, whether we're making stew or sopita in Spanish, it's
Right.
working and we're going to keep making it. So,
Yeah, I love that. That's a great idea. So, Karen, for this play, I'm curious about this. So the utterances and play and kind of that naturalistic context, is that something where you are following specific like lesson plans, or are there different centers and you're giving the BCBA's instruction on
yeah.
potentially how many utterances to evoke, or what does that look like? I'm just curious. I know that with a center like yours, I'm sure it's very programmatic and there's like a very much a plan. Some places, it's a
Yeah.
little more loose, right? So, and depending
Yeah.
on your funding source, right? In a school versus,
Yeah.
insurance,
Totally.
it's going to look totally different. But I would imagine like collaborating with RBTs, or what does that look like on how are you informing? Because it sounds fun and I'm just curious.
Yeah. No, though those are such great questions. I do appreciate, even though we are programmatic, I feel like Marcus lets us, we have some creative flow, if you will, or make suggestions. So
Right.
I think the one thing that we forgot to mention is as we were thinking through this SLP
Mm.
pilot and what that would mean would be there's a component of consulting. And through those
Mm.
consults, as Katie mentioned, she got to observe my sessions, but I spent lots and lots of time observing BCBA RBT sessions.
Nice.
Sometimes I would push in. So
Yeah.
in the moment. And so to go back to answer your question about how was that structured, we both had like actually a similar sort of long-term and short-term goal. And so we knew that ultimately we want this child to communicate. And that's where the tweaking came in. So whereas Katie might say, well, we're working on these list of preferred items. And then if in our case, he was presenting with some motor speech compromise, like a compromised motor speech. So he was having difficulty with some of the production. We were able to work together to say, well, ultimately, we know he can communicate using a device, maybe 3-word, but we're still wanting to also work on that speech. What are
Mhm.
some things that I as an SLP can help facilitate from a developmental, but also from what a child can do with his articulation? I don't know if that answered the question.
Yeah. Yeah, no, that's great. And it's I think it's good. Like a lot of people might be listening and thinking like, wow, this is like the gold standard of collaboration, which I think it's great to hear that if people are just kind of starting on their, I always say like just introduce yourself to the person, the BCBA or SLP. So wherever you're at on your collaboration journey, I think it's great to kind of aspire to and hear about some of these nuanced ideas. But I love the idea of the consulting because when I was more school-based, I would spend a lot of time with it wasn't necessarily an RBT, but the one-on-one parapro to talk about like how's the programming going and like spending time watching sessions and having them with me. And I think even if that's something that's out of somebody's comfort zone, just you can learn and grow. And I can just tell like how jazzed you guys are about working together and helping kids. I mean, shoot, let's apply at the Marcus Autism Center. It sounds like a great place. Yeah, thank you so much for coming onto the show. This was amazing information to hear about, and thank you so much for taking time out of your day. I appreciate it. It was great to meet both of you.
Absolutely. Thank you so much.
Thank you so much. It was lovely meeting and chatting with you. Look forward to listening to your shows.